I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course.
Speak fast. Today we're going to talk about what is a pinched nerve. A lot of people get a pinched nerve or they get a pain and they say they've been diagnosed and they say, well, somewhere you have a pinched nerve. We're going to kind of talk about where you can pinch a nerve and what it is and what symptoms it gives you.
Sure.
So first let's talk about the symptoms. What are the things you're going to feel when you have a pinched nerve? One thing you might have quite often is pain, because you're getting compression on a nerve is what is happening. And the nerves are coming out from your spinal cord and going from the spinal cord into your arms and into your legs.
And in this area, they wrap around the trunk.
Sure, they wrap around the trunk. So you can get actually pain or a compression of a nerve anywhere in the body, in essence.
Right.
So let's start talking about some of the common symptoms you're going to feel. First off, you can have pain. You can have radiating pain, pain that's going down the extremity. You can have
numbness, burning, tingling. A lot of times people in the clinic, I know that when they've got it in their low back and it's going down their leg, I just had a woman yesterday, it feels real tight, a pulling sensation.
Right.
It's hard to describe a nerve pain compared to like a pain where you're, you know, if you break your arm, or a mechanical pain is very clear, where nerve pain is also.
It can be ever changing too.
Yeah, exactly.
And,
It's weird.
Quite often when people start getting, and that's a good way to put it, a lot of times when people come in and they're having really strange symptoms, I often go, you know what, that sounds like nerve pain. Because nerve pain, it just gives you really weird things. You can even get like hot and cold sensations.
Sure, yeah, exactly.
Pins and needles. If you start getting weakness in the arm, that's quite often
and that's
can be
getting
from
more serious.
nerve pain. That's getting more serious. Spasms,
Mm-hmm.
that can be from nerve compression too.
And one thing I want to point out, as a therapist or a physician or a chiropractor, we pay attention to where do you feel the pain. You know, is it on the front of your arm or the back of the arm, inside of the leg, outside of the leg, because that tells us possibly which nerve is actually being pinched. We know it's all mapped out where L3, the nerve coming out of L3 in your lumbar spine, where that goes down in your leg. We know at L5 goes down the top of your foot if you feel symptoms there.
Right. So where you're having the pain, it could be where you're having the pinched nerve, but quite often it isn't.
Right.
It's a real treasure hunt here, kind of trying to figure out, investigative job trying to figure out where the problem is coming from. So let's talk about some of the common areas where you might have a pinched nerve. Nancy, could we have the spine right away? Who's catching?
There you go.
Okay. We got our spine here.
Spine.
This is really where a partial head here. These are the bones that stack up to make your back. You know, within the bones itself, there's a canal, and that's your spinal cord. And coming off the spinal cord are these nerves. All right, these are the nerves that can get compressed or pinched.
Right.
All right. One of the common areas that can get pinched is right when it's coming out of these holes here. Right in that spot here. As you get older, you want to zoom in, and Brad, can you kind of point out?
Sure. Yep. Okay, so now the nerves, remember, are not a half-inch long like I'm here. They actually, the nerves in your lower back, they'll go down into your arm. The nerves in this area will wrap around your chest, and the ones down here go down to your legs. But here's that hole Bob's talking about where the nerve exits from the spinal cord, directly connected to the spinal cord.
And as you get older, your neck will become arthritic.
Sure.
I can tell you, from age 20 on, it's deteriorating. These holes start to get smaller just from arthritic changes.
Right.
And so there's less room for the nerve to get out. If, let's say, the nerve gets a little bit swollen, suddenly there's no room for it to come out, and it's getting pinched right as it comes out.
Sure.
Less common in the lumbar area because these holes are quite bigger. But what can happen in the lumbar area, Brad?
Bigger?
The holes there.
Larger.
Larger, okay. The holes there are larger.
Okay.
And so there's a lot more room for the nerves to come out. So it's unlikely that you're going to get pinching from the hole itself in the lumbar area, but you can get a disc problem.
And here's a nice model. We talk about a slip disc. That's really not correct. It's a herniated disc. And a herniated disc, you can see here. Can you zoom in on this? Pretty good. The bulge right here.
Why don't you show a healthy disc first, Brad?
Yeah,
This is a healthy
sure,
disc.
that's a good idea. A healthy disc is kept in here. It's usually a little thicker in the front, a little narrower in the back. And
It's
usually
all contained. It's
exactly. Boy, we've got another video on some details on the disc. Without getting into that, the disc will actually bulge out and put
Or
pressure
herniate out.
Yeah, put pressure on a specific nerve, and that nerve will send symptoms wherever that nerve tracks, and here they go down into the leg.
And that, the pain that you get also often from nerve pain is quite often some of the worst pain you can get.
Yeah,
nerve pain is not fun. I mean,
exactly.
you know, when you can tell when someone's drilling into a nerve, that, you know, that's the way they'll make you talk if they want to torture you. So the other thing that could be causing pressure on a nerve is even scar tissue. If you injure a nerve, the nerve can actually get scarred down, and when you move it, it actually puts pressure on it and causes increased pain. I've had people that have had scar tissue on a nerve in their back, and we actually had to stretch that nerve to break up that scar tissue.
After a surgery, sometimes you can have scar buildup or an injury.
So the other thing is, as the nerves come out, anywhere along this path, they can get pinched somewhat.
Sure.
And the common one that many of you probably know about is carpal tunnel syndrome. And there's a band, or a ligament that goes across here, and the nerve crosses underneath that ligament. And especially if you do a lot of repetitive activities like typing, or where you're bending your wrist this way or this way,
factory type
work, that ligament can thicken up, and there's less room for the nerve to go under, and that's where you can get pinched nerve also. So the job of the physician or doctor or physical therapist is to figure out where along this path for your arms are you getting a pinched nerve, or where along, you know, your legs, where from the back to the legs are you getting a pinched nerve, and which we usually call sciatica.
Sure.
The other thing we thought we'd talk about a couple fun ones, right, Brad? There's some names out there for nerves that get pinched, and these are the ones that are generally more of a temporary pinch, but one is called Saturday night palsy, and this is apparently what happens if you fall asleep like on a bar or over a chair, like that. You're getting pressure on the back of your nerve, your arm there. That's a radial nerve palsy, and you'll wake up and you're so drunk that you don't wake up at all. You wake up in your arms. You can't move your arms because they're numb.
They cut off so much that the nerves cannot fire the muscles. It's I've never experienced it.
You wouldn't even know what that would be. But another one would be honeymoon palsy. You fall asleep and your honey's on your arm like this.
Yeah, this looks like your honey.
Yeah, this is my honey. And all night long, and you're afraid to get away from her. And there's a joke too about gnawing off your arm. We won't talk about that. But that also causes a palsy in your arm. Another one could be related as a handcuff neuropathy.
I wouldn't know about that either.
That are too tight, they can actually put pressure on the nerves. And the last one we're going to mention is a crutch palsy. I wish we had some crutches here, but that's why when you use crutches, we try to teach you that you're really not trying to hang on to them or lean onto them.
It should not put pressure into your armpit.
Right.
It should be going through your arm.
You got a big plexus of nerves coming through your armpit here and into the arm. And if you lean on those crutches, they're actually going to cause...
The crutch pad is not made for padding to put up.
The pressure should be on your palms and squeezing the crutches in so that they're...
I got another one though, Bob. I'm going to show you this one.
Another palsy?
Yeah. I don't know what you call it, but she can't see me.
Oh.
If I go to sleep on my stomach, which I don't much anymore because it bothers my back, but if I sleep like this, I've waken up and both my arms are completely asleep, completely lifeless. I can't do anything. I've already done this and I bit my hand. Like, you can't feel a thing. It's pretty fun.
Oh, I woke up one time and the alarm's going off in both arms.
Like that?
Yeah. And I'm going like this, turn the alarm off.
That's kind of fun.
The other one that is a common one that is you're driving along. This is why you shouldn't wear your wallet in your back pocket. You're gonna actually pressure on your sciatic nerve. And I had it one time where my foot fell asleep, and I was hitting the brake, and I couldn't feel it. And I'm coming to a stoplight, and I can't stop the car because I'm pushing it with all my might. So I stopped wearing my wallet in the back pocket there. So
that's that big thick wallet he's got.
Well, I just got papers in it. There's nothing else in it. Believe me.
All right,
Good luck to you.